Yeah, so we were really just gonna give, and it's lovely, it's amazing to see everyone here today. We were just gonna give an overview of kind of the ambition and aims of the National Trauma Transformation Programme, so that we can all kind of feel like we're on the same page as we get started. And then I will pass over to Derek and Jenny, who will give a bit more detail and overview around the findings from the local authority delivery trial, the valuation report, and the national learning report. And there's a huge amount of synergy across the two, and it will really open up some learning around enablers and barriers for implementation and next steps and recommendations from that learning. And I think that will really provide a nice way into hearing from colleagues from across local areas as well. So if I can get the next slide, Jenny, thank you. But I will give a very brief introduction to the National Trauma Transformation Programme before we really get stuck into the really interesting learning around implementation. As Kathleen said, the Scottish Government and COSLA have a shared ambition to have a trauma-informed workforce and services across Scotland capable of recognising where people are affected by trauma and adversity, that's able to respond in ways that prevent further harm and support recovery, and can address inequalities and improve life chances. And the NTTP has been in multiple programmes for government since 2017. And it's a major and long-term change programme which aims to support Scottish Government and COSLA's vision. And it's built on the NHS Education for Scotland's Psychological Trauma Knowledge and Skills Framework and Training Plan that were published several years ago. And the programme provides a really wide range of learning resources, guidance and implementation support for all sectors of the workforce, including leaders, to upskill staff to the appropriate level of trauma-informed and responsive practice, and critically to embed and sustain this model of working. And there's a huge amount of resources and tools available on the NTTP website, and you'll get a link to the website shortly if you haven't been able to visit it yet. The programme is a partnership across Scottish Government, COSLA, NHS Education for Scotland, Resilience Learning Partnership, and the IS, the Improvement Service. And hopefully you'll have probably heard of us as the National Trauma Training Programme, but last year we shifted to the National Trauma Transformation Programme, and I think from the learning today you'll hopefully see why that is. Can I get my next slide, please, Jenny? I won't talk about these in any detail at all, but I just wanted to really highlight we're seeing a commitment to a trauma-informed approach increasingly embedded in pieces of legislation, in key national strategies and practice guidance, ranging across policy areas from justice to housing to alcohol and drugs and public protection, for example. But I think as I think the Minister and Councillor Morrison also highlighted, it's important to recognise the current context that we're all working in, of time and resource and capacity constraints, and having to do more with a lot less across public and third sectors, and also recognising the impact of the cost of living crisis, the impact of trauma, for example, and the pandemic on staff and across our communities as well. So it can often feel like there's a huge amount of asks on all of us, and these can often feel quite overwhelming. But I guess one of the key messages we wanted to promote today is that a trauma-informed approach is designed to support the delivery of the work that we're already trying to do across our organisations and services locally and nationally. So it's really designed to be a supportive demand rather than a competing demand. And I think we'll see that learning coming through today as well. Can I get my next slide, please, Jenny? So I think what we'll see from the learning today as well is an emphasis on thinking about implementation holistically across a service or an organisation. And this really reflects the evidence base and international learning that we have as well. So one of the key points I think you'll hear today is that as we've already talked about, workforce training is a key component of any organisation's journey to becoming trauma-informed and responsive, but we absolutely know that equally important are the culture, environments and supportive ways of working in an organisation that can enable sustainable change, which will ultimately make a difference to all of us who are affected by trauma. So, for example, no matter how trauma-informed a practitioner might be, if we're then constrained by protocols or policies that don't recognise the impact of trauma, we might then be unable to minimise the risk of re-traumatisation that our training has taught us to recognise. And this can really risk disempowering staff, creating a sense of helplessness, and potentially leading to disengagement from empathy for the people that we're supporting. And we all have experience of, we know that we're working within complex systems as well. And the complexity of these systems can sometimes mean they work in ways that can be unintentionally re-traumatizing. They can risk causing more harm and might create barriers for those of us affected by trauma to access any specialist and universal services and opportunities that we need and have a right to respect. So this slide is really there to kind of emphasize that we need to think holistically about trauma-informed organizations, services and systems. So thinking not just about that critical component of workforce skills and knowledge and training, but thinking about everything from leadership and organizational culture and staff care, support and well-being, to our policies and processes, to how we power share with people with lived experience of trauma, and how we design and deliver services. And again, we'll hear more learning about that today. Can I get my next slide, please, Jenny? I think one of the other key points we'll hear today is that this work takes time and it's a journey, and it absolutely can't happen all at once. And there's lots of work happening across this journey, across local areas in Scotland. I think this is an amazing opportunity to be able to celebrate all of that work. But as we'll see from our speakers today, I think so much of the implementation work that's been happening so far has been focusing explicitly on the first part of this journey. So the very first point on this slide, called creating the right conditions. And what all the evidence tells us, all the learning tells us, is this is about getting a service or an organisation or a team to the point of being ready to start this work. So really taking that time to reflect on what's our organisational culture like. Do staff feel safe and supported and well at work? Is the organisation ready to try new ways of working? Have leaders made a long-term commitment to this work and understand what's involved? So again, I think we'll hear lots more about this work being a journey as we go through our learning today. And can I get my final slide, please, Jenny? And I just wanted to finish with thinking about outcomes. I think we can often, with all of our work, often get caught up in thinking about process, activities, inputs, outputs, and not necessarily outcomes. So this is a logic model. You probably won't be able to read all of the text on it, but this is the logic model included in one of the NTTP resources called the Roadmap for Trauma-Informed Change, which really starts to try to give us some consistency across Scotland around what we're all trying to achieve when we're talking about embedding a trauma-informed approach. So this is quite a generic logic model and could look different for different services, organisations and communities across Scotland, obviously. But that logic model is designed so that we can see there are multiple benefits to embedding a trauma-informed approach. All the evidence tells us that there are benefits for our staff, for those of us with lived experience of trauma who are navigating specialist and universal services and support. And there's also benefits for our organisations and services, because we know a trauma-informed approach can support the existing outcomes and priorities we're already working towards locally and nationally. So we'll learn more today about the work of implementing a trauma-informed approach across services, systems and workforces, but also how we can start to understand the impact of this work. So I really hope that everyone feels kind of inspired and energized by all the work that we hear about that's happening across local areas, and I really encourage you all to think about how we can individually and collectively, as Kathleen said, build on that momentum to develop this work and really strengthen that collective leadership and collective action across this work. So I hope that was a useful overview before we get launched into some of the more specific detail. But I will pass back to Jenny and Derek now. Thank you.
Morning, everyone. Again, just to reiterate, it's fantastic to see so many people here taking the time out their day to hear more about the work that's taken place through the programme. I just want to start by providing a little bit of background to the local authority delivery trials and also the evaluation that was carried out. So the delivery trial started in 2019. The three local authorities that were already mentioned were involved. That was Argyll and Bute, Glasgow and Midlothian, and each received £40,000 in funding to support their early work. Now, each of the local authorities involved had very different operating contexts in terms of their own size and scale, the makeup of the geography that they covered. Each had a different level of experience in terms of the work that had already been undertaken to develop trauma-informed workforce and trauma-informed services. So very different starting points for each of the three local authorities. And then on top of that, each were taking a different approach to delivery in the trial, and that's in terms of the service areas that they focused on, whether they were taking a bottom-up or top-down approach, a mixture of both, whether they were using external training providers to support delivery. So a lot of differences in there as well. And what was quite surprising to some degree is, given those differences, was the consistency in terms of the enablers and challenges and the learning that was being generated through that delivery. And I think the other thing that's important to point out about the delivery trials is that, given it started in 2019, they obviously took place during the COVID-19 pandemic, which inevitably created some unique challenges, but also brought about it some opportunities to do things differently as well. Now, the follow-up evaluation, and it was a follow-up because there was an initial interim evaluation that was commissioned to run alongside the delivery of the trials, but given the impact of COVID-19, that evaluation really struggled to get the engagement it needed to report on all the things it was expected. So this follow-up evaluation was really picking up where that evaluation left off, and what we were focused on was understanding the progress that had been made, the various enablers and challenges that had influenced that progress, and to capture that wider learning that will help inform the future of the programme as well. It was a largely qualitative evaluation and mainly involved in-depth one-to-one interviews that engaged with 28 stakeholders across the three local authority areas and 2 national stakeholders supporting the delivery of the trial as well. If I can pass across to you now, Jenny, to say a bit about the learning report.
Thanks so much, Derek. Yeah, hi everybody. It's really great to see so many people here. I can only reiterate that from everybody else. I'm going to tell you a little bit about our national learning report, which we've developed this year and published over the summer. So we know from the evidence that embedding sustainable, trauma-informed and responsive ways of working is really rooted in long-term culture change, and that this doesn't happen in one step. It's a process, it's a journey, as Laura kind of emphasised earlier. So at the start of this year, we asked local areas across Scotland to tell us a bit more about the progress that they were making in terms of embedding a trauma-informed and responsive approach across their local areas, and the impact that work is having. And the findings in the learning report that we produced have really been supported and informed by a survey that we shared with local trauma lead officers and other key contacts across Scotland, across all 32 local authorities. And we had responses from 31 out of the 32, so that gives us a really good kind of basis for some of the learning and some of the kind of themes that have come through in this report. But it was also informed by learning through the local trauma leads officer network, including development days that we've had with lead officers over the last year, and the trauma champions and trauma lead officers workshops that we've been coordinating from the improvement service, as well as information that's been shared with us through kind of one-to-one support provided to both of those networks. And I just wanted to really recognise the huge variation in approaches and scope and priorities, the stage of development, and variations in additional investment across local areas across Scotland. And just reiterate that the findings and the learning from this report are really not intended to kind of compare local areas against each other, but rather it's to, the aim is really to understand key learning, themes and priorities from across Scotland in relation to advancing and embedding this work. I think the findings in this report hopefully it represent really important learning about what works, about the barriers and about the enablers to embedding a trauma-informed and responsive approach across services, systems and workforces. And it's really evident that change is well underway across Scotland and across our local areas. But given the different local priorities, the context and the needs, a lot of local areas are at different stages of creating that change throughout their organisations and systems and workforces. And whilst we're seeing progress being made across all 9 of the key areas of work included in the roadmap, which Laura outlined earlier in the earlier slides, what we were hearing and what we're seeing through the information that is shared with us by local areas is that a majority of local areas have really prioritised activities that relate to organisational readiness, so staff well-being, leadership and organisational culture, as well as training and implementation, so looking at staff knowledge, skills, confidence and capacity to take forward this work, and to really help create those right conditions for this trauma-informed and responsive change to take place. We know that this work is kind of a cycle of continuous development, so it's not surprising that we're not at the end of this journey yet. We're really kind of just starting out, but it's really encouraging to see all of the work that's happening across our local areas across Scotland. And I just wanted as well just to recognise the huge scope and the vast kind of the vast scope and remit of this work. There currently is no prescribed role for trauma lead officers who we obviously primarily have engaged with for this learning report. And the role looks really different across the local authority areas where they are in post. Most are based within and have a remit for supporting a trauma-informed and responsive approach within their local authority or their health and social care partnership and or within wider community planning partners. But they really sit across really diverse teams, really and have really different setups and remits. And I think that this, what we heard in terms of the engagement that they've had, it really shows that they're really touching upon kind of all services across council areas, including a range of key community partners and services across the third and voluntary sectors as well. And I think that range of engagement really highlights one, the integral role of the trauma lead officers in coordinating this work across their local authority area, because it is so vast, but it also highlights the appetite and the need for support across all parts of our local systems and emphasises really that trauma really is kind of everybody's business. Briefly as well, we wanted to think a little bit, one of the things that we set out to do when we started developing this learning report was to think about what progress we've made towards the outcomes that were set out by Laura in the National Logic Model. So we asked local areas across Scotland to what extent they were or are seeing signs or evidence that the work that they're doing locally is contributing to these outcomes in the Logic Model. And I think it's really encouraging to see that there really is some evidence of early progress towards these short-term outcomes, primarily around staff understanding of trauma and the skills and confidence of staff to respond to trauma, as well as to some extent around leaders understanding and drive to kind of drive forward this change. And I think that probably mirrors kind of where the focus of work has been to date across local areas as well. But I think also important to recognise that where local areas have perhaps identified little or no evidence of impact, that is really not a sign, or shouldn't be interpreted as a sign, that there is no progress in those areas, but I think rather a reflection of the challenges of measuring and capturing the impact of this work, and that potentially local areas at this stage don't kind of have capacity for measuring change in this current context, or that they require additional support to do that and to develop those evaluation approaches. I think I'll pass to you here, Derek, to just say a little bit about some of those challenges and some of what you've been seeing in the local delivery trial sites as well around this.
Yeah, when we were discussing progress and particularly achievements, stakeholders tend to reflect on three main areas. That was on the workforce, the progress made in terms of service review and redesign, and also early impacts on people who are accessing services. Now, it's probably important to say that the evidence gathered through the follow-up evaluation was largely qualitative and based on staff observations, largely what they had seen and heard, the changes in practice and behaviour, and feedback that they had received as well. And just to echo what Jenny said, most commonly the stakeholders spoke about programme activity having led to a more trauma-aware and trauma-informed workforce, and that was across all three of the delivery trial sites. Stakeholders spoke about that increase in trauma-related knowledge and skills amongst staff. And that was across different roles and different levels of staff, from the senior leadership through to practitioners, down to administrative and reception staff. There really has been a widespread of staff that have been involved in the various opportunities. And stakeholders were seeing that learning being applied and resources being used in day-to-day work and day-to-day practice. Now, it was spoken early on in this presentation about creating the conditions, and that training of staff, building that understanding, building that awareness and building that knowledge, I think has been a key part of creating the conditions that can then lead on and help support the service review and redesign work that is taking place to help ensure we have trauma-informed services. So the program's very much been a catalyst for that. But what I would say is much of that work was at the early stages, whether that was planning for review activity to take place or the beginnings of review. But there were pockets where more progress had been made in terms of creating trauma-informed services as well. And really, at the heart of this change, stakeholders spoke about improving service accessibility, making the delivery of services less judgmental, non-stigmatizing, more nurturing and asset-based and relationship-based as well. And some of these changes were already being observed. And like I said, while progress was being made, there's also this acknowledgement that there's a lot of work to be done. This is a very, very long journey. And another thing that came through really strongly, and we'll touch on again later, is the importance of the involvement and participation of people with lived experience in the service review and redesign activity as well. Recognising the unique view that they bring in their role in informing what a trauma-informed service should look like and feel like. Now, when it came to impact on the people who access services, again, there was little pockets, there was little examples, but stakeholders spoke about kind of witnessing the changes in practice, seeing more supportive and positive interactions between practitioners and people accessing services. So it's really been about creating those more supportive environments and trauma-informed working practices that can help lead to better outcomes for the people who access the services. And Jenny's absolutely right. We heard a lot about the challenges in embedding evaluation practices and processes and systems. Again, there was some activity going on, some evaluation activity to measure people's reaction to training, what they had learned, what their intentions were around using that learning. But it was really that longer term bit of evaluation to say, okay, so what change has actually taken place and what difference is that actually making that is missing at the moment? And there is a real need for some national level support around that activity going forward as well.
Yeah, thanks. Thanks, Derek. I think some of those challenges we were really hearing through the National Learning Report as well. And I've just pulled out a couple of quotes around some of the challenges around measuring the impact of this work and the nature of that. The long-term nature of culture and systems change work means that it's it's really hard to at this stage see the impact of some of the kind of more medium and longer term outcomes, and to kind of see evidence of that at this stage is probably not realistic. And as we've been touching on already, the kind of focus has really been on organizational readiness and early implementation over the recent years. So the focus hasn't really been on implementing really robust evaluation approaches. But yeah, I think we'll maybe move forward and think about some of the enablers at this point as well, and what is making this work at local level. So some of the kind of key enablers that we've been hearing from local areas across both the National Learning Report and that's coming through in the local delivery trial sites as well is really one of the key things has really been around leadership buy-in and organizational commitment to a trauma-informed and responsive approach, and that's really been identified as one of the key enablers for successfully embedding and progressing this work, and for making it work at local and national level. And we'll say a little bit more about that in a couple of later slides, so I'll not touch upon it too much right now. But other things that local areas have also highlighted is the need for this positive collaboration across policy areas and engagement with staff from across council services and partners, and really taking this joined up approach and recognizing that this touches upon lots of different service areas. It is integral to a lot of different policy areas and agendas as well, and kind of successes around that has included kind of training inputs and briefings with teams and services that maybe traditionally haven't been associated with requiring trauma training. So for example, libraries and council contact centres, estates and road services, building services, kind of services that we maybe don't traditionally associate with a trauma-informed approach, but who very much come into contact with people in their communities. And there might be particular challenges around adapting that training delivery, but local areas have really highlighted how taking that kind of joined up cross-policy approach has been really key for the commitment and success of rolling out a trauma-informed and responsive approach across their local areas. And they also identified that the appetite from staff and services to learn about trauma and to improve their responses has been really key in making this work and embedding this at local level. And the importance of the trauma lead officer role, or just a lead role at local level, to coordinate this and sustainably kind of progressing it locally to really champion this work at local level has been really, really key in sustainably kind of making this systems and culture change work. Derek, I'll let you say a little bit more about the other three there.
Yeah. I think the involvement and participation of those with lived experience as an enabler and as adding value to a programme isn't unique to this programme. I think the role of lived experience in supporting service design and development is widely recognised in terms of the insights, ideas, the unique perspectives that people with lived experience bring. And for this programme, it's been no different. We've seen examples during that evaluation of participation of lived experience, involvement in local steering groups to help set the direction of the trial. They've been involved in co-creation activities in terms of new service materials, supporting service walkthroughs in terms of looking at the environment, and wider service review activity as well. And different areas have used different approaches to engage those with lived experience. In some cases have accessed pre-established lived experience networks. In other cases have drawn on the support of third sector partners as well. But I suppose one of the things I do want to raise about the involvement in lived experience and what was highlighted during the evaluation was the need to ensure that appropriate safeguards, supports and check-ins are in place for those with lived experience to make sure that their participation is a positive experience and really just minimising any potential for any negative impact that it may have on them. It goes without saying when we talk about staff buy-in and support across an organisation, especially when we're looking at a programme that does touch on everyone, it is an absolute critical enabler that you need that support, you need that buy-in. And that starts with understanding amongst people as to why this is valuable to them, why it's valuable to the people that they support and work with as well. And while this is linked back to leadership, which, as Jenny says, we'll touch on a little bit later in the presentation, with this sort of programme, it needs leadership at every level. And what we've seen in each of the trial sites is where you have that shared responsibility, shared ownership, individual members of staff and teams and services wanting to take on that responsibility and support and drive forward that change, that can really be a great enabler to progress as well. So absolutely critical that you get that critical mass of people that are bought into the programme and want to support it as well. But with that comes the need to ensure that there's appropriate support in place for everyone that's involved in the implementation and delivery activity. And that includes those that are leading and coordinating this at a programme level through to the staff teams and individual members of staff who are implementing changes to practice, or those who have taken on ownership and responsibility for aspects of service review and redesign as well. Getting that right support in place is essential to ensuring plans are realistic, obstacles can be removed, challenges can be overcome, and really just sustain and push with that momentum. And the final part of that is really about local areas not having to reinvent the wheel and having access to resources that supports implementation activity, freeing up their time and capacity so that they're not having to create something new. Another thing is much of the enablers and challenges that have commonly been faced in the programme, as we've said, they're fairly consistent. And giving people the opportunities to learn from each other and draw on the support of peers in similar positions can be a huge assistance. And it can also be hugely reassuring to know that you're not the only one experiencing this challenge. And look, over there, someone's taken steps to be able to overcome that. And just creating those spaces for people to be able to share that learning and support each other is hugely important as well. Very quickly, online versus face-to-face is very much about understanding about the trade-offs. Both were used during the delivery trials. Online was more a forced position because COVID had come along, and therefore the only way moving forward was to deliver online. But there was different experiences of face-to-face and online delivery, and largely that reflects people's learning preferences and learning styles. So it's just something to consider as well. I suppose if there's one thing on this slide, it's about the importance or the value of carrying out some sort of mapping exercise or a needs analysis so that you can really understand what the needs of each member of staff are, what each role needs in terms of the level of trauma training, to make sure it's relevant to their job role and the responsibilities that they have. A needs analysis can also help to target training and identify the areas where it's needed most to really direct any rollout as well. We can just move on from there, Jenny.
Thanks, Derek. Yeah, just very briefly, as we've kind of touched upon already, both in the learning report and the local delivery trials, the importance of leadership was really emphasised as one of the key enablers to making this work at local level, and that includes engagement and support from senior leadership, such as senior managers, chief officers, council leaders, elected members, etc., but also operational managers supporting their staff teams, and the need for continued support to strengthen leaders' understanding of this work and how that this can support existing local and national priorities was really emphasised in our engagement with local areas. Again, I've just pulled out a couple of quotes from our learning report around local areas, reflections on why leadership is so important. And we also know from the evidence that the committed leadership can is really key to sustaining trauma-informed change, and that really includes leaders embodying key trauma-informed principles, but also creating the scaffolding and accountability for progressing this work and recognizing that it takes time, resource, and commitment, and that leaders really have a key opportunity to use their role to create spaces and places for power sharing across their organizations and to support and encourage collective action around this agenda. And we're really looking forward to talking a little bit more about what that might look like at both the local and national level a bit later on in the event today. But I'll pass to you, Derek, to say briefly a little bit about some of the barriers that we've identified as well.
I'll try and be as brief as possible. So high workload, understaffing, recruitment challenges, heard so much around this, and really a recognition that many teams and many staff are under immense pressures day to day, and that has a huge impact on their ability to engage with the programme. So even attending training, finding the time to do that, making changes to practice, engaging in that broader implementation and service level change activity, taking on that responsibility and taking on that ownership. And I suppose what was really highlighted by stakeholders was the importance of non-tokenistic and accessible support for staff well-being as well, and really making sure that that's in place. A recognition as well that many of these staff experience vicarious trauma on a day-to-day basis as well. Leadership and organisational commitment go hand in hand, and we've spoken about the importance of that leadership support and buy-in, so I'm not going to say more about that now. But stakeholders emphasised the need for a whole systems approach to ensure that consistency of experience across the different services. And in many instances, the lack of integration of service delivery and the lack of joined up working was highlighted as a barrier. But at the same time, it was also acknowledged that different services, different organisations are at very different places in terms of the trauma agenda. And that obviously has a huge impact on how you can approach this in a joined up way as well. This has been said several times today. It's a long-term game. Is this culture change? Is long-term service change? Is long-term and practice change can take a while as well. And I think long-term programs of this nature, they require long-term commitment, they require long-term planning, and with it, the assurances that there will be longer-term funding there to support the activity that's required. And there was a number of calls to move away from annual funding allocation to support this work to more long-term funding that actually set the groundwork and enabled that longer-term strategic thinking and planning to take place. Jenny, you can move on.
Thanks so much, Derek. Just to finish up and just looking ahead, a number of actions have been identified through both the National Learning Report and the Local Delivery Trials Report that are needed to help fully embed trauma-informed and responsive system and culture change and to achieve the best possible outcomes for people affected by trauma in Scotland. And these include strengthening local and national collective leadership, governance and accountability, adopting a long-term cross-policy approach to this culture and systems change work, and strengthening links between this work and other key policy agendas that are focused on tackling inequalities and adversities, as we heard earlier from Laura. Investing capacity and resource in the national training model to support consistency and sustainability, and ensuring organisations are ready and workforces are supported to implement change across policy and practice, which includes power sharing with people with lived experience of trauma at a time when they are facing unprecedented pressures. I think more broadly, stakeholders really highlight the need for a trauma-informed and responsive approach to be recognised as fundamental to the aims of broader public service reform, and really highlighting how this trauma-informed approach supports our existing collective efforts to improve outcomes for communities across Scotland. And I think if we really focus on that, rather than competing demands and thinking about how we join up those efforts better, then we can get some way towards achieving those aims and commitments and ambitions collectively. Thanks so much for listening.